All right, this is a special opioid crisis community. This is Monday, May 2nd, 2016. We're at 6 p.m. I have Councilor McKinnon.
Here.
Councilor Mangan.
Here.
And I have Councilor DePiero.
Here.
We have 3 members present. We do have a quorum.
Please stand, salute the flag. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
They're both here.
Councilman DePiero?
Thank you, Mr. Chairman. Can we invite our 2 guest doctors up to sit up front?
Yes. Just, if you could just both state your names and titles.
My name is Michael Baldessari, and I'm the Director of Special Education for the Everett Public Schools.
Thank you.
My name is Scott Dara. I'm in chiropractor family practice in Melrose, Mass.
Say it one more time.
I'm sorry, Scott Dara, chiropractor family practice, Bay State Center Family Chiro in Melrose, Massachusetts.
Thank you for appearing. I invited both these gentlemen. I wanted to actually hear from Dr. I think it's Dr. Your last name again? Scott?
Oh, Dara.
Dara. Okay.
It's a nice Irish name.
Yes. Do you have a presentation?
I do.
Okay. We have a USB port, I believe, up here. If you know how to, run that.
Yes.
How long would the presentation be?
You tell me. So, if you want, I can make it 15 minutes, I can make it 25 minutes, I can make it 30 minutes, up to you.
Why don't we go with 15? Is that
All
okay
right.
with you, Doc?
That's fine.
Okay.
Is that all right?
We could do like 15 now?
Yeah,
And
sure.
you'll cover all the points?
That's fine.
All right. Thank you. Dr. Baldessari, how was your time in April there?
I'm sorry?
There was a couple of days that you had, or a day that you had invited us to.
Oh.
I was in Atlantic City, so I couldn't attend, but.
We had the Mental Health Summit.
Yes.
Yeah, we had about 70 to 75 attendees. We served a full breakfast. And then we had our partners from the mental health community outside of the public schools as panel presenters, so that the administrators and the school employees in attendance could have a dialogue back and forth about how we can communicate better, where we go for certain services for students who are in high need, because we've had, as you know, we've had some of our families have been in some pretty tough situations with their children.
Yeah.
It's been going on for a long time, but it seems as though the din of those issues is becoming more profound as time goes on. So.
Very interesting.
Yeah, it was a great event, though. We're going to do it every year, so
Yeah,
perhaps you
it's
can make
needed.
it next year. Yeah.
So, but, Anthony, can you ask Caroline if we can turn this on? We're looking forward to attending next time.
We'll have more. There's plenty of events that we have planned throughout the year. I mean, that's one of them. And you'll be getting more invitations, I'm sure.
Sure. And you also work within the prison systems as well?
Yeah, I work with the Middlesex House of Corrections, Franklin County, Worcester County, and the Pondville Department of Corrections, the state facility.
Yes.
And I've been doing that for it's about a year and a half. I work mainly with fathers who, when they're released from incarceration, will be going home to be dads. So do a lot of work with the impact that their incarceration has on their families, and a lot of work with how they can better connect with their children and families when they return.
Now, do you know, we had Sheriff Katuji
Yeah.
and his people before us, and they have a Vivitrol program there they run out of there.
What's the program?
Vivitrol? It's a shot once a month. And if they're clean for, I
Yep.
believe, 14 days, they can actually, get the injection.
The, most of the work that that I've been involved in has been with, around the parenting. But when I'm with the, when I'm spending time with the inmates, I hear about, a lot of the programs that they have.
Yeah. We're going to go to the presentation.
Yeah.
We'll get back.
Okay.
Thank you.
Thank you for giving me the opportunity to speak. Once again, my name is Dr. Scott Dower. I'm a chiropractic practitioner.
So they can hear you at home. Green button, yeah, there you go.
Can you hear me now?
Yeah.
One of the advents, and given the fact that I know this is affecting us locally, on a national level, when the CDC came out with their guidelines, I'm going to just prevail. Everything that up here is referenced, so if you ever want information or research or something like that, I'm more than happy to provide all that information to you. Some of this stuff is actually taken from our Massachusetts State Society, and I will also tell you that with the new CDC guidelines for opioids, it was a breath of fresh air for the American Chiropractic Association on a federal level, given the fact that they really wanted to turn to more conservative, non-invasive, non-pharmacological interventions first for dealing with pain management and obviously conservative pain management. Chiropractic healthcare is that elephant in the room. We are that one that's focusing on a subluxated spine, which is affecting the neurological function, which is why people manifest pain. Just a brief background on who I am. My background's in laboratory medicine. I focus heavily on health education. I've worked in numerous hospitals all over the country, and I'm the past state board director for the Mass Chiro Society in charge of public health education. I resigned last year in order to take care of my parents. The facts on the third largest healthcare profession is the #1 drug-free pain management healthcare profession in the U.S. It's been providing care for over 120 years, non-invasive, effective pain management for many conditions, including headaches, neck, and back pains. It's often used as a substitute for more expensive care and offers a safe and logical alternative for the use of opioids to relieve and manage people's pain. It has the potential to save many cities in the Commonwealth lots of money in the treatment and management in many cases, as well as save the human costs for addiction. Understand, too, that chiropractic healthcare is also the #1 in patient satisfaction when compared to other healthcare options. So understand, too, in public health, the insidious harm of inaction and its failure to provide a healthcare service when it would have produced a favorable outcome for the patient. This is really what we're trying to talk to in terms of underutilization. I'm going to skip a couple. I may skip over some slides just for time perspective, but just so that you're well aware. Our profession is just some basic information. We're the third largest healthcare profession behind medicine and dentistry. Safe, effective, and as I said, drugless. There's years of research demonstrating its effectiveness. It's utilized in every aspect of healthcare, hospitals, sports. The United States Olympic team, Beth Israel Deaconess has a spine center, 6 chiropractors on staff. Winchester Leahy Hospital Chiropractic Center has 5 chiropractors on staff, one of whom was his husband and wife are very good friends of mine. Chiropractors in a hospital environment is very effective. Understand, too, even in international, in Denmark, they use chiropractic within multidisciplinary centers, regional spinal disorders, in community health centers throughout the state. We're working with Governor Patrick's office or his administration for years trying to get chiropractic departments established in all the community health centers. The Department of Defense, 42 out of 120 VA centers nationwide under Public Law 107 through 135, not enacted for musculoskeletal diseases, which is the #1 ailment of Iraq and Afghan Veterans Administration seeking care. Chiropractic services are not available to them, even though there is law. A lot of, and you'll hear me, a lot of red tape. When you are the largest drugless healthcare profession in a drug-infested world, it is very difficult to make means. And understand, too, the only people that benefit from our care is the patient. There's no third party. So there's no pharmaceutical companies, there's no medical supply companies that actually benefit. It's only the patient. Understand, too, I could, cite cost effectiveness. The biggest one that comes to mind is the one that was actually just came out. Chiropractic has the potential to save insureds over $15.8 billion and adding almost $692 million in wages. And yes, I have the research to show that and explain all that. So understand, too, in chiropractic, we tend to look at causes as to why people are having a lot of the pains. We're focusing here on addiction. So a lot of times, too, people always say, well, what does chiropractic have to do with addiction? The problem is that we're trying to focus in on more of a proactive approach, whereas now sometimes we have the problem, so how do we deal with this from a reactive standpoint? A lot of times patients that do consult us in chronic pain can use chiropractic from a management standpoint, just like they may manage their pain with an Advil or a Tylenol or a Aleve or some other form of NSAID. The problems sometimes can begin as early as even in sports. So as we know through the movie Concussion, we know that physical activities can create sports injuries in children, that if they're not getting the proper spinal care and proactive approach, then that can start them on a path of pharmaceutical intervention. Even parents may use it, in which they actually advocate or may even steal from their parents to try to get medication. But understand, too, that in our profession, it starts with the pain management centers not offering the benefit. So it really starts in the pathway. And this is what, when Governor Baker, we met with Governor Baker's administration a few months ago, and when he was setting up the opioid committee, the national, one of my colleagues, Dan Fanslow, who practices in Westboro, he sits on that committee for the Mass Chiro Society. Understand, our biggest complaint was the pathways. And at the same time, too, is how the patient is triaged and managed. If there is a chiropractor who is trained in non-pharmacological intervention and conservative approaches to getting somebody to function better, then that's better off than them saying to them for a primary, say, well, here, try this, see how this does for 30 days, and then let's reevaluate you at the end of a month or so. So we start a patient off right off the bat with non-pharmacological interventions through the adjustment process, through maybe natural supplemental to actually help decrease inflammation. Understand, too, that if chiropractic is eliminated for younger people and it's only available to older people, then you cannot effectively prevent a lot of these potential problems. So the American Chiropractic position on this topic applauds the CDC's position for drugless approaches. Health plans, they need to have inclusion for people of all ages, not necessarily just for adults only. So we've had this problem in the past where Blue Cross Blue Shield has had a 16 and under exclusion, or even worse, Tufts would just, we have a lot of patients that actually it's eliminated completely. So in the Commonwealth, chiropractic is mandated under a public law. I have it in the presentation. I don't know right off the top of my head. But it is mandated for all HMOs that do carry this. So understand that under the, now, the healthcare systems and the way that the third-party payers are set up, they're set up in what's called ACOs. So it's kind of a fancy version of an HMO nowadays. So the account care organizations basically go in, and third-party companies like Blue Cross Blue Shield or Tufts or Harvard Pilgrim or Network, they'll go in and they'll go into Brigham and Women's Hospital, and the broker will go in and they'll negotiate, or they'll negotiate with Winchester Hospital Physicians Group and say, we're going to pay you $10 million to manage our patients over the year. And then at the end of the year, if they only use $5 million, then they have a $5 million surplus. And at the end of the year, that gets disseminated into the physician's bonus packages. So understand, too, that chiropractic is not only is it cost effective and can save money, it has been proven and shown over time again to save money, but it's also very cost effective. Because getting an adjustment, getting nutritional counseling, getting some exercises, some rehab, sometimes in an office, it's not elaborate, it's not as fancy as getting a microdiscectomy, but preventing that microdiscectomy is phenomenal. So Medicare will pay for failed back surgery syndrome, which, if you don't know, already has its own CPT and ICD-9 code. So they pay for failed back surgery, but they won't pay for effective conservative chiropractic intervention. So it takes a crisis to create a committee. And so we're trying to offer we're trying to offer non-pharmacological interventions through the education of our profession, because, to be honest, our profession has not done a very good job of public health education. And one of the reasons that is because, well, the AMA was found guilty in 1987 in the Supreme Court for trying to eliminate our profession. You have false educational information, which our society intervened into the health education to all the third-party payers. You have pamphlets like Neighborhood Health Plan, like I have, that has 20 new chiropractic providers on the back, but the pamphlets don't include anything. All they include about is drug updates and surgeries and referrals. So there's nothing about safe, non-invasive, conservative intervention for care for, whether it's musculoskeletal disorders or even some visceral disorders. So education is largely not done upon third-party payers, but mostly upon individual providers such as venues such as this. Understand, in the state we have about 1,800 DCs providing care to about 6.5 million people. That translates to about 1 chiro per every 3,500 people. So it's a very underserved healthcare profession. Understand too that, you know, things that have to change is the way, like I said before, it has to change in policy. It has to change from the way things are managed from the get-go. Algorithmic protocols for pathways of patient care, educating on this, and normal financial savings that could have been obtained by enhancing our profession's utilization. And so really that truly counts, that actually is where our profession plays a very integral role in this. This is us, just in case I am that elephant, FYI. That was my 15 minutes spiel.
Thank you, Doctor.
We'll open it up to the floor for the other councilors. Any questions, gentlemen, on that? Councilman Mangan?
Thank you, Mr. Dara, for that presentation. Just, like you said, if the pharmaceuticals and stuff seem to be making headway with a lot of different things, and, I mean, is it a matter of lobbying at the State House, or just you have a proper lobbyist and so forth? Because I certainly agree with this, as to any way we can.
Stephen Pangiotakis is our lobbyist on the Hill, as well as Jimmy Hurl. So it's never about, we are in a constant battle of always trying to put out fires. And there are, like I said before, when you're the largest drugless healthcare profession in a drug-infested world, there's always people that are trying to squash us like a pig. So we are a small profession, but we're also very vocal. And we, believe highly in a lot of health education. I can speak on probably behalf of our state board. Having sat there for 9 years, I know what our goals and objectives are. So it is not so much about lobbying as it's about implementing. And so we've, trying to deal with federal regulations, and that's why it was very important to have a governor that was very much on our side and working with his administration. The governor before that it was impossible. But when you have, governments not working on your side, and we don't ask for much. And really, but we hate to always be in a warning kind of stage. Oh my God, there's a bill that's going to eliminate, all third-party pay under chiropractic healthcare. It's like, so then you spend all your time and effort just dealing with that, as opposed to, okay, here's the problem, here's what we need to do, and we would love, like I said, we would love to get, chiropractic divisions established in all healthcare centers, in all hospital divisions, in all community health centers, where I'm sure that there's a major problem. So we've gotten to the point where we are like this close, and then it just never comes to fruition.
The other thing too is then, is there, like, let's just say, thank you, is there enough chiropractors, let's just say in this general area, to really, let's say at some point you're successful or whatever and they implement that, is there enough chiropractors around to feed the needs of the people? I mean, that's especially with, with back and leg and head and, neck.
Absolutely not.
Make sure it's green.
Really, truly, under.
Doctor, make sure it's green. Yep, you're on.
Absolutely not. We, I'm in Melrose, there's 3 of us. I don't know how many Everett has. I think Malden has maybe like 2. One of the reasons why I chose this area was because there's no practitioners for the amount of people. I will tell you this, there are 2 chiropractic colleges that are within about 3 hours drive here. So you have University of Bridgeport College Chiropractic in Bridgeport, Connecticut. One of their externship programs is they've established chiropractic centers within all the community health centers. So their final fourth year term students are doing rotations in the community health centers. You have New York Chiropractic College, which has external clinics on Long Island, Syracuse, as well as the main campus up in Seneca Falls, New York. The right people could definitely be obtained. In other words, if people understood that there was a growing need, I'm sure, and I, with my last breath, I would probably be able to staff it, as well as I'm sure on the state board. The problem was not so much creating the opportunity. The problem was, to be honest, was how are the doctors going to get paid? And this has been talked over time and time again. Dr. Jimmy Lehman, who's a professor at UBCC in Connecticut, he is really an expert on establishing chiropractors into these community health centers and has done so very successfully for the past probably 10 years. So there are people, there are resources, and there are people within our profession that are very knowledgeable. If you want to, I could always put you in touch with these people just to get ideas or suggestions. So I mean, I can tell you, we are, when I tell you we're on top of it, we're on top of it, the best that we can. You know, we are people of action. So when a problem comes, we're there to provide potential solutions. It's just about getting that education out there too.
Because, and I actually agree with you 100% on this, because I know a few years back, I had a problem with my back, and, you know, again, I'm one of, I don't like to even take aspirin or anything like that, and I remember going into, because my brother had saw him, and in Boston on Boylston Street, actually right by where the Marathon Bombing was. I forget the name of the gentleman that was, it was up on the second or third floor.
You're talking about Copley Square Chiropractic.
Yes.
Yeah.
Okay.
See, we're a close-knit community.
Okay, so I remember
I
going there,
understand,
and the
yeah.
gentleman, it was great, whatever, and they actually did a lot more than I thought they would, because I had problems with my hip and things like that, and there was a lot of stuff that I wasn't even aware of that they actually do,
I mean, I can tell you,
and it helped me, so, you know, it was great with me.
you're just one of millions. So my point is, and a lot of, millions of patients that, you know, I hear these stories all the time, you know. Either I hear it either really, really good, or I hear really, really bad. You know, and it's like I tell people, it's like finding a dentist. Just find someone that you're comfortable with and that helps you work towards your healthcare goals, because it's hands-on. I just can't say, hey, Mike, your triglycerides are up here, take Lipitor. Hey, Mike, your thyroid's high here, take Synthroid. You know, in other words, it's not, we literally have to touch our patients. So there's a very personal, you know, repertoire with people,
Right.
whether it's, you know, 20% of my practice is pediatrics. So I deal with pregnancy. I'm certified in turning breech babies to avoid, you know, decreased C-section rates. You know, I mean, there's so many aspects of our healthcare profession that can have a huge impact. But do you really think that the OBGYN really wants to hear about decreasing C-section rates? No, of course not. Do you think that the surgeon wants to hear about decreasing his microdiscectomies? Absolutely not. So understand, too, it's a business. And we already know the business of pharmaceuticals.
Yeah, I would definitely be interested in, like I said, some of those contacts and people, like I said, certainly I would like to reach out to them just to get their input and so
Absolutely.
forth. So,
And a very similar talk like this was just put on City of Waltham, just FYI,
Oh,
just so that
really?
you know.
oh, okay, that's great to know that. All right, thank you.
You're welcome. Thank you.
Any other questions from the councils? Seeing none, I have a few. From the chair. Now, that right there would be an alternative to any type of pharmaceutical or any type of pill or anything like that. That's an
Absolutely.
alternative. Okay, so that's where we're going with this. Your practice, and how many doctors are involved with just your practice?
I try to keep things simple, so I focus on sole proprietor.
Sure. Now, other than, I mean, in the state of Massachusetts, how many are?
You're looking at about 1,800
Okay. Now, would we be able to maybe
access.
access those 1,800?
Absolutely. I can put you in touch with our state society.
Okay.
And at the same time, too, which of the 1,800, there's probably about 700 which are members of our state society. So you're still looking at a large amount. There's still a lot of politics within our profession as well, in terms of practicing, models of practice, things of that nature. So there's always disparities. You know, I always tell people, if you want to get 10 different opinions, get 10 different chiropractors. But at the same time, there's one thing that we usually can agree upon, and that is, you know, a focus such as this.
Now, this right here is part of, like, the addiction cycle.
Absolutely.
This is I mean, I could tell you stories because I've had them within family and also out of family and friends, that they actually started by having an injury, then they were prescribed a medication, and it was an opioid. And, you know, we all know the stats because we had one of the governor's task force people here, Mr. Steve Tolman, was here. He testified before us. 82% of the opioids are taken right in the United States. So it's a lot of opioids.
Sure.
That's 4% of the population taking 82% of the opioid population. So that's staggering. So maybe this would be an alternative to that. And then maybe we could start turning it around.
See, and it's one thing I always tell my patients. I say, you know, for me to go and visit the medical doctor, that's alternative.
Sure.
I said, you know, it was, you know, staying healthy, getting adjusted regularly, eating okay, you know, exercising, Although getting married really doesn't decrease your stress level, but for the most part, it's honestly, if I break a leg or God forbid an emergency happens, something like that. But it's like you educate people on how to try to stay healthy, or at least implement maybe some healthy behaviors into their lifestyle, which actually, believe it or not, will actually have ramifications on medical usage in the future.
Well,
Huge.
some of the commercials that they show of the addiction centers, they come out with alternative ways to treat pain. That's what you are
Absolutely.
right now. So, okay. Could you, for the record, just state your name, your practice, and a telephone number that you could be reached at?
Sure.
Because this is being aired live right now, and it goes out to the whole city.
My name is Dr. Scott Dara. My practice is Bay State Center Family Chiropractic. I'm a family practice practitioner in Melrose, Massachusetts. My phone number is 781-662-3333. My email is info@baystatedc.com.
Thank you, Doctor.
Thank you.
And before you leave tonight, if you could just, stop in the back and speak to our secretary, just give her the information and any information that you would provide for the state that you said you would provide, that information as well.
Okay.
Dr. Baldessari, now we move to you. Thank you, sir, for appearing tonight. We started a little conversation way back when, about 15 minutes ago. So if you can just continue where you started, that would be great.
So we're talking about the work in the schools?
Yes, schools,
Yeah.
prison systems,
Okay,
you
so,
elaborated on both.
And so obviously in the Everett Public Schools, I'm the Director of Special Education. I oversee educational programming for a little more than 1,000 of your city's children. And those, those are students that have learning disabilities and other impairments that impact their ability to learn at the same rate as their same age non-disabled peers.
Mhm.
As a special education administrator, I encounter a lot of the issues of society because they play out in our schools, they play out in the homes of our children, and it's really unfortunate that a lot of our children have been identified as having learning disabilities, sometimes because of the environments and the things that they're exposed to as they're growing up. And then in my private life, I have a company in which I work with 4 correctional facilities in the state, perhaps more as time goes on. And the primary focus of instruction at this time is parenting for fathers who are going to return home post-incarceration and oftentimes post-addiction, to return to being fathers part-time. Some are returning to being fathers full-time, and many are leaving incarceration and then going into some type of a custody situation where they have to work to be able to have either supervised or unsupervised visits with their children. So I've spent a lot of time working with a lot of families who have a lot of needs, and that's not just now here in Everett, but that's been about the last 2 decades of my life. So how can I be of assistance to the council? And I'm curious to know how I can help.
Well, what we're trying to accomplish now is, and I'll speak from the chair if there's no other questions. Do you have any other questions, anyone, right now? Okay. From the chair, what we're trying to do is we're trying to get a handle on this earlier than later. Right now, we're sort of living the Narcan day, where it's like the last step for these people that are out there on the streets now. You hit them with Narcan, you bring them back, stuff like that. I think that we could probably make a little bit of a difference, or maybe a huge difference, if we can get to these children earlier on.
Yes.
And I think that if we could do that, that would be a great thing. And if we, I spoke to the school department, they're looking into this right now. So you being from there as well, and also your other role within the prison systems, you have a dual role here. You see both ends.
Well, I
So-
see, it's funny, I mean, they spent a lot of, many years, learning to be an educator and learning to be an administrator. And then when I took my work outside of the schools and into the prisons, I was going to work there, and while I was at work, I was learning.
Sure.
Because I was in a new environment with new people who are, many of them, the fathers who I work with are, they had their challenges when they were being educated in their schools.
Yeah.
And, how addictions form. I mean, thank you, doctor, for, talking about how the medical industry works. So we see that play out with our students in schools. Very often, when children are identified as having ADHD or other,
This is where I wanted to go with that. Thank you.
other, things that manifest in the learning environment that take away either their ability to learn or the ability of their peers to learn because of the way that they're acting in class. A lot of our doctors and in our medical community, the answer is to provide the child with some type of a drug. It's often a stimulant, Ritalin, Adderall. And the idea is that this medicine will have a paradoxical effect on the child, that they'll give the child a stimulant and it will help the child stay calm or focus. And it begins there, but they're not always necessary, because the other things that we do that don't involve medication are mental health counseling, and cognitive behavioral therapy, and having our staff be trained in how to properly intervene with the child that does not create a higher level of crisis. So a lot of the work that we do to hopefully have our kids be educated without the need for pharmaceuticals is in the training of our staff.
Sure.
And how we work with kids in the schools. So I see those things, and it's not the school's decision, obviously, to have a child be medicated. It's a parent's decision. But I think sometimes things get really, really tough, and they're getting calls from the school about the behavior of their children, or their children aren't passing their classes or aren't achieving, and they look for whatever remedy they can find. And so the dependence on a pill can begin at the age of 7.
Yeah.
And
That's horrible.
then by the time a child who's taking these stimulants is 14 or 15, things change. They start by trying less illicit drugs like marijuana.
Yeah.
And
Now,
then
are you seeing any of this?
What's that?
I'm sure you're seeing some
Yeah.
of this where you are.
things progress and they get worse, and I think that's happened for a lot of kids and a lot of teenagers and a lot of young adults. which
Just a
pushes this
question, another question would be that some of the mental illness or some of the mental deficiencies that a child would have, they would actually seek that type of remedy just to feel like a normal human being?
Yeah, really what we see a lot in the schools is children who have
To fit
had-
in. They
to-
want to fit in.
Yeah, well, there's many reasons, but one of the, what we see in special education is children who have been traumatized.
Mm-hmm.
Okay, so they've had either sexual abuse or physical abuse, different types of neglect. Parental incarceration is a type of is a childhood trauma. Domestic violence in the home. If there is a substance abuser in the home, it does not have to be a parent. If there is a parent with a mental illness in the home, that when these things happen, these children unfortunately become more likely to engage in reckless behavior, which includes a whole spectrum of things, but unfortunately drugs and alcohol becomes
The outlet.
more prevalent, as they reach their teenage years.
So, how do we change it? How do we stop that? How do we stop overprescribing? How do we do all that stuff that we're looking at? It's a tough question. If you don't have the answer, I understand.
Well, you want to?
I just wanted to make a note. Early on, we the way sometimes a lot of these kids are conditioned, we're in that mindset of if there's a problem, you know, like Dr. Mike was saying, we give them a drug. So it's like, I have a problem, take a drug, I have a problem, take a drug, I have a problem, take a drug, I have a problem, take a drug. And so you set up that behavior early on so that when he does get to be 10, 11, 12, 13, 14 in his adolescent, early adolescent, high school years, it's like, oh, I have a problem. This is how I'm going to do it. I'm going to take a drug. So in other words, they get in that mindset as opposed to, I have a problem. What's the cause of this problem? How do I deal with this? How do I educate? That kind of thing. Now, granted, sometimes, and I'm not against medication, I'm just against the overutilization of it as it's,
Sure.
you know, so easily prescribed nowadays. So, you know, if it's needed, you know, it's needed. You know, from our end too, you know, sometimes you can't blame the physician, you know, from their perspective because that's what they're trained to do. That's their tool in the toolbox is the drug or you know, making the referral. So unfortunately, you know, like you said, sometimes you need the medication just to kind of get through while you're searching for the cause. But like obviously Dr. Mike was saying, there's many social factors involved in what you're going to do and how you're going to manage that child.
Yeah, we do. I mean, there is though, aside from, I mean, some children do need the medication.
Sure. No,
But
that's agreeable.
as you gravitate from the Midwest to the East, the more east you go, the more prescriptions for Ritalin there are. Okay, that's not, there are statistics out there that show that somewhere in the United States, there's not a lot of kids that are prescribed Ritalin, but by the time you get to New York and Boston and the Eastern Seaboard, the prescriptions are, you know, it's just really,
roof.
really high in numbers.
Yeah.
So our approach at the schools, you know, there are education programs, you know, anti-drug curriculum, you know, throughout our schools, and obviously, we have school rules where, you know, drugs have no place in school. We are working really, really hard to train our staff to work with the most challenged students and work with them well. Because relationships with their educators and pro-social involvement in schools, clubs, activities, those things reduce the number of students who use drugs.
Yeah.
Having them have a positive experience in school reduces drug use outside of school. And this is not, you know, rocket science.
Yeah.
But the hard work for us is making sure that our staff has the proper training, that we have the right people who are working with the students who are in the most difficult situations, and that when we find kids now who are having drug-related issues and other issues, what we do now is we have them undergo a clinical assessment inside the school, and this is new, and or a home assessment where one of our licensed clinicians would, you know, assess the child and decide on a prescription not of drugs, but a prescription of counseling. And we have students throughout the system receiving as little as 30 minutes of counseling every week, and some well over an hour a week of counseling actually during the school day. So for us, you know, providing mental health counseling to our kids in school during the school day is a prescription that does not involve any type of pill.
Sure, that's actually good to hear. I know that I did an hour-long program with a pediatrician here in the city. Basically, he was saying sometimes it's an imbalance for the child, and for them to fit in, they start going down the wrong path, and they start doing the alcohol, the marijuana. Then it leads to bigger and better things. Then we see them at the end stage where we're at Narcan Day.
Yeah.
So it's good to hear that you are trying to get on top of that.
You know,
right now.
back in 2000, it was 2003. I was working as an assistant principal at the time,
Yeah.
and I had a really unfortunate occurrence where I actually took a syringe full of heroin away from a girl, a 17-year-old girl, during the school day. This
Yeah.
was at Stoughton High School in Stoughton, Massachusetts. And after that took place, you know, myself and all of the administrators and educators in the school received a fast education. one thing that we learned.
It's a wake-up call.
Yeah, yeah. One thing that we learned was that, you know, not every child who smokes marijuana will use heroin. But every one of them who used heroin did smoke marijuana. So, you know, we learned that, and that was really important, and we understand where the starting point is.
Sure.
And that's really important for us in the
It's
school.
the gateway stuff.
Yeah.
That's what ends up, you know, progressively getting it worse. I mentioned Vivitrol earlier.
Yeah.
Do you know anything about that program? Because they had
No.
mentioned it before. It's
That-
14 days clean, then they hit you with a needle once a month of Vivitrol.
Okay.
And basically then it stops the inhibitors
Yep.
within your brain to actually stop the narcotic from entering, and it just stops it so you don't feel the effect of any type of narcotic or the opioid narcotics, actually.
Okay.
So it seemed like it's working. It's in the prison systems now. So I know it may be even the first one in the country that he's trying to do, and that he is Peter Katusian.
Yeah, he's very innovative, and,
Yeah.
you know,
he's-
when I teach the classes, I tell the inmates that they're very lucky to have a sheriff who, you know, who looks to find programming, you know, and have them involved in counseling, education, and all sorts of programs throughout the day and into the evening.
I was wondering if it does actually spill over into the state system or into, you know, the other counties. You said Worcester,
Yeah.
Pondville is the
Yeah,
state.
When I, working in the county system, the inmates tend to not be staying incarcerated as long.
Yeah, it's like a 2-year,
Yeah,
maybe 3 at most.
and in the state, sometimes they could have had a longer stay.
Sure.
So much more time to, you know, to get clean and to hopefully.
Work on the issue.
Yeah, work on the issue and focus on other things. But I don't ask my participants what their issues were, but they certainly do offer.
Sure.
And drug use, drug abuse is, you know, I'd say that more of my participants had drug issues than anything, you know, for sure.
I'm going to open it up to the floor again. Any other issues? Okay. I want to thank both you gentlemen for appearing tonight. If you could leave just say it once on the air, your information, your title, and then.
Dr. Michael Baldessari, Director of Special Education in the Everett Public Schools.
And is there a number that anyone could reach you at because it's being aired live?
My office number is 617-394-2400.
Thank you. And I would ask that if you could leave your information as well.
Okay.
Thank you, gentlemen, for appearing.
Thank you
Excuse
so
the
much.
customary thanks.
Thank you.
All those in favor? All those opposed? The ayes have it.
Mr. Chairman, I'd like to invite up Chief Mazie at this time. And
Is
he's
it
on the
on?
audience. I know there's a couple things, but I think they all kind of relate to each other. to
So we
some-
can bring him up? Okay.
Yes, and then, I mean,
Who else?
even if we want to have a roundtable again and have the
Yeah,
mayor's
just-
policy and everybody else up at.
If everyone could come up so we can actually have you before us. Just state your title, your name for the record.
I'm Elaine Silver. I'm the nursing supervisor for the Everett Health Department.
Thank you.
Good evening, Steve Mazie, Chief of Police for the City of Everett.
Thank you.
Hi, I'm Catherine Rollins. I'm the Director of Policy for the City of Everett.
Thank you. Thank you for appearing tonight.
Thank
Councilman
you, Mr.
Magid?
Chairman, I know you had one on here, and then Councilor DePiero had 3 different things on the agenda, so I guess you can maybe just take them one at a time and just
Yes.
go through them, so I don't
If
know.
you could read
the clerk
item
wants to
number
read
1.
it, or if we just wanted to just discuss it, whatever, and I don't. get
We'll,
them
we'll
in
have
here.
the clerk read it, and then we'll go from there. Can you read item number 1? Oh, they're all. Okay. Make a motion, collective. Go collective?
Mr. Chairman, I'd like to make a motion to have the clerk read all of the items as they are all part of the discussion tonight.
Motion
Second.
made and seconded to take these items collectively. Could you please read 1 through 4?
All right, item number 1, this is a resolution offered by Council McKinnon to address the fake Xanax and Ventolin combination that has been killing people and purchased on the streets. Item number 2, that the administration consider equipping every municipal building with Narcan, perhaps placed in every AED case. Likewise, that every school nurse and community health nurse be stocked with Narcan. That was offered by Council DePiero. Item number 3, the administration and first responders consider creating an opioid response team to follow up with addicts after overdoses. That was also submitted by Councilor DePiero. And item number 4, that the city considers different ways to limit and prohibit the sale of synthetic marijuana.
Councilman DePiero.
Thank you, Mr. Chairman. Most of these pieces tonight are, kind of to get input from all of you guys as well. It's not just something, that we want to do immediately. We want to know how you feel about it, if you think it's a good idea, and so on. So, if any one of you wants to just give an opinion on any of these types of things, the Narcan in the AED cases is something I saw presented by a counselor in a neighboring city, and I wanted to have a discussion about it. The first responder response team was something a few other cities have. Wanted to get an opinion on that as well. So if any of you would like to start with that.
In regards to the schools, I met with Mr. Forrester and Mr. Obremski on the 25th of April with myself and the public health nurse. All of the school nurses have been trained to administer Narcan for the last 4 years. We've been trained and we retrain every single year. We spoke and discussed in regards of having Narcan available. At the end of our meeting, our conclusion was the goal would be to have Narcan in all 9 buildings of the school department. We would start with the high school. The Narcan would be placed into the AED boxes, and we would have some kind of a sign put there and made so that people would be aware that that's where the Narcan was, so that it would be available all the time. And also, it was a suggestion with the school department. They have their trainers who go to all the school events, and they have an AED, to also have them equipped with Narcan in their AED to do that. We're in the process right now of pricing the price of the Narcan. The school department had kind of leaned towards, I don't know if you're familiar, there's 2 types of Narcan administration. There's one that you take apart, mostly people know you take apart and you put a little nose on it and you put it together, it's like a little plunger. And there's also what we call an auto-injector. It's in a little tiny little box, you take it out, it tells you exactly what to do step by step. We've used the EpiPens in the past. It's a very easy thing, so we were trying to come to a conclusion that would be the best. Not everyone knows how to administer Narcan, and in an emergency, to be honest with you, you can forget everything that's going on. Fortunately, I think we have probably one of the best 911 systems. We've had it in the schools that we've used them. You call 911, they're there before you even know it. So the school department thought that maybe they would get the auto-injectors. The price of the auto-injectors is extremely high. It's like $580 for 2 of them in a pack. That includes 2 auto-injectors and a trainer. And you have to also remember that the Narcan is only good for 2 years. So after 2 years, everything has to be replaced. So we are in the process of doing that with them.
How much is the nasal?
The nasal is around, I believe, $33 or $35 a dose.
And will that come in a pair of 2?
No, that comes in 1 with the trainer.
1 with the trainer?
Yeah,
Okay.
we would only place them. All of the school buildings, I don't know if you're aware, do have 2 AEDs in the building, but I think we would probably start with 1 Narcan, and probably on the main floor where they're used the most. Because remember, the age group that uses the Narcan is usually the group outside of the high school ages, of the school ages, but we discussed the fact that you have a lot of events going on in the school, you have employees, you don't know who is going to need it.
Thank you. I'm very happy to hear that that's already in motion. I guess my next point would be for maybe the chief and/or Ms. Rollins from the mayor's office in regards to the response team. And, you know, if you think it's effective, chief, if you've heard of it and seen any benefits from it and what your feeling is on that.
So regarding response team, I mean, let me back up. So a number people that we deal with, when I say we, the police officers, police department personnel, who are involved in drug situations regarding use, addiction. Many of the officers have repeated dealings with, you know, they build a rapport with people. Those who, and informally for years now, those who want help, are considering help, a lot of times the officers can give a push and help people out. They will. They'll take the advice or they'll steer them in that direction. On the other hand, we also deal with a large segment of the population on criminal matters that are drug addicted as well. And sometimes those people don't want anything to do with us or want to be getting visits from us, I guess I should say. So I have mixed feelings on it. I mean, I think the people we can reach, we try to reach from a police end. The other people, there's an element that I don't think they want to see us. I don't know if we'd be the wise choice to be automatically going back out to some of those people's houses. The other thing too is some people would be reluctant if it was strictly a police driven group because of our enforcement powers and authority. We show up at someone's house, you know, hey, can we come in and talk? And now all of a sudden we see stuff, something that's illegal or inappropriate. That could,
Understandable.
I mean, could cause some other issues or problems. So I would have mixed feelings on it.
Okay. I'll yield the floor if any of my colleagues have some questions for our guests.
Any other questions? Councilman Magan?
Thank you, each of you, for appearing here tonight. Getting back to what the schools, certainly if it's, as I said in the other meetings, if it's something to do with the financial thing, you know, I'm all about whichever way we can and try and help them. We all have to work as a team in doing our part. And so I'm certainly happy at some point, and if you want to come back to this committee and report maybe like, whether it's the next meeting and the meeting after that, in terms of financially, what do you think to equip it properly, not to do it, you know, halfway, to do it the right way. You know, what do you think? If we're able to do a partnership with the school department instead of just them having to foot the bill. I mean, I certainly would believe that, you know, not only myself, but some of my other fellow councils would be willing to, you know, to help, because this to me is such an important thing. And like I said, there's no cost that, you know, that can really, in my mind, like I said, that would deter me from trying to do the right thing here. So whether it's the next meeting we have next month or the one after that, I would certainly, if you would willing to come back and maybe give us an idea of what we're looking at, because we're going to be starting the budget thing soon, but certainly give an idea that we can at least bring back to our members in the city council to say, you know, this is something we need to consider, and this is, you know, they're going to be looking for a certain amount of funding. So if you could get this committee certainly an idea of what we would be looking at, I would certainly really appreciate it. And again, doing it the right way, not halfway. And the chief, so would you still, I know you, and I agree with you about the going to people's houses and they might find it a little bit offensive or they might want to cooperate, but outside of the police, do you certainly see the need for the city to, whether it's just regular professionals in the healthcare industry, do you think it's definitely needed that we need to have a response team to go out to some of these individuals and target some of them that maybe don't want to deal with police officers and so forth to help?
Well, whether it's a response team or an individual, a trained clinician or someone that understands the problems and can help match people up with services or try to give them the services, I mean, no doubt. I mean, that would definitely be helpful.
Okay. And then, I know there was one on here, you had about synthetic marijuana. I don't know what, I mean, is that a big problem in the city?
Well, I mean, any kind of, illegal drugs, some of the synthetic drugs are not illegal by state, federal law, and a lot of times state and federal government are playing catch up. We've had our share of problems with synthetic drugs that are extremely dangerous, but so on any illegal drug. I mean, and then you get the whole prescription issue, which not taken properly, as we know, leads to a whole slew of problems. So, you know, people unfortunately take a whole mix of designer drugs, illegal drugs, and then legal drugs that are prescribed. I don't know this. I don't know if, well, first of all, you can't enforce something that's not a law yet.
Correct.
So, but there is another piece of legislation that are being proposed to make these designer drugs illegal.
Okay. Thank you very much.
Just for the council's information, this will be going to Senator DiDomenico and also Representative Joe McGonigal, this piece. So we're trying to get on top of that as well. Councilman McLaughlin.
I would also like to thank you for attending tonight. I have a couple of quick questions. One is for the school department. To be truthful, I didn't know that there was 2 different types of Narcan that can be administered. Have you guys decided which one, beyond cost, which one is most effective for the school department? Which one is pros and cons versus the 2 of them?
We were trying to think of in terms of who would actually be using the Narcan to administer it. Majority of the time, you may see it used when there is not a nurse in the building. You may see it being used when there actually is, lay people in there. And most people do know how to administer it, but the dexterity, I don't know, have you ever done it yourself, Chief? I don't know, yeah. It's not that hard. To us, it's easy. To me, it's easy. But I always feel that in an emergency, and to be honest with you, I guarantee you that what I've seen in the city for the past 16 years, 99% of the time, you dial 911, you don't even start to administer an EpiPen, and they're there for you, okay? In terms of, would it be easier for the auto-injector? It would. We're waiting to hear back because we did have the EpiPen auto-injectors in the school, and they were recalled because it was a question as to whether or not, I don't know if you're familiar with them, they have a little needle, it's a little box, and you open it and it tells you, and you press it against the side of a leg and it counts it down and it tells you it's administered. There were some questions and some data that they got back that they didn't think that the whole dose had been administered, that there was a problem with it. I did speak to some people who have used the Narcan, the auto-injector, in other areas and other communities. They haven't had any problems with it. They saw the response time just as the same. So it's maybe just be a matter of what's available and what we feel would be the best at that time.
Okay. So we haven't really decided on which of the 2 is most suitable.
No.
for the school department.
No, they didn't. They were the ones actually that brought up the auto-injector, that they had seen it and they had thought about that one. Was that easier?
Because I also agree with Councilor Mangan that if it becomes a funding mechanism that we need to be able to find, we in City Hall are really good at being able to find money that we can appropriate to different projects that we don't think of at the beginning of a budget session. So we can, I'm sure through Mrs. Rowlands, I think we could find some money to be able to allocate to help with that if that was the case. So if that's where we need to go, then we should be going that avenue. That's why I wasn't sure if we were looking at one versus the other.
It was just we kind of talked about it and, where to start right away to go into the high school. And then it was our suggestion to go into all 9 buildings, even though that's not an age group that we see it in. But because of the school buildings being used so much after hours, we felt, and it can happen to an employee. It can be one of your own employees,
Absolutely.
so that's what we thought of.
You should do all 9 buildings because you never know a school activity. A parent comes in unfortunately and has an issue within the school during, during or after school for an activity or whatever the case might be. All 9 schools should be outfitted with Narcan.
And that was, the school department was really very, very pro with that. So we just finished getting back all these figures, so now I will be meeting again with Mr. Obremski and Mr. Forestier, hopefully within the next week or so. So I will take back the information, and thank you for offering that. I think they'll be glad to hear that.
Yeah, no, that's great, and we look forward to, as Council Mangan said, hopefully you coming back with a report maybe in the next meeting or so and being able to share some direction of where we're going to go and how we're going to be able to administrate all 9 buildings with the Narcan dosage. It would be great information for us.
Okay.
Chief, I have a quick question for you. I kind of agree with you that the police department may not be most suitable to be able to go into homes where we have somebody that may have been involved in a drug activity. What do we do for somebody that has an overdose, goes to a hospital, we're able to revive? Is there a program that they, lesson that they learn there at the hospital before they're released? You know, it's follow-up at home, but what is the follow-up after, prior to leaving a hospital? Or are they just discharged back out?
I don't, lesson, I mean, another crack at life, but I think they're just released. There's no, go home and don't use heroin or, opioids. I mean, that's,
Sure. And that's where it's something that I honestly think, because I, to be truthful, I know an individual that had that exact thing happen, and she went home, and she unfortunately a week later had another episode, because she was never really given the right direction. She was just released from the hospital a few hours after something happening. So I wonder if how we work with the hospital administration to be able to, keep them while they're there, to try to give them at least some information, some direction.
I think they're restricted. I mean, if someone wants help, I mean, those discussions usually come up. If someone wants help, they'll be offered, avenues to go. If someone doesn't want help, I mean, that's a different story. But they won't discharge unless the person's capable of going out the door. But there are restrictions too. They can't just hold them there.
Sure.
Once they've been treated.
I understand completely. If I can ask the chief a question, and this may be off subject, and it's okay, I will defer to another meeting if so.
You have the floor, Counselor.
Chief, in Gloucester and in, I believe it's New Bedford, a couple of communities in the state have really done a good job at making their police departments an open door policy, inviting individuals in and basically allowing them to surrender themselves without fear of prosecution, of fear of being arrested. What are we doing in Everett to, and you don't have to answer it tonight, it's something we can have a conversation about in the future, but what are we doing in Everett to be able to open our doors like Chief Campanella did in Gloucester, to make people aware that the police department is a friendlier place, and you're not going to be prosecuted for wanting the help and asking for the help. You're going to be lifted up and given the help that you need.
So, I mean, departments usually have reputations, and the reputations are based on acts that have occurred with previous experiences by members of the public interacting with the police department. I could tell you, reputation-wise, we don't, and this is the big, I guess, misperception that's gone on for a while. I know some people in my own profession keep saying it, that, we're not going to arrest our way out of this. We don't arrest addicts for being addicts. That's never really happened. We arrest people that commit crimes. Many times, people that are committing criminal activity have an addiction problem. But because someone has an addiction problem, for example, and they go out and they rob a bank, that doesn't get them off the hook, or at least not with us. They may get, as part of their disposition, they may be ordered to drug counseling at that point. Usually it's a case of they didn't take advantage of it before, but now they're being ordered to take advantage of it. So over the years, I mean, and I've been around long enough to know, because I've dealt with people back when I was on the streets, we've always been willing to extend a helping hand to people to do exactly what's going on in Gloucester and some other places. It's not really a totally new concept. The only thing that would concern me is I don't want to open the door and invite people into Everett when we have our own people to take care of, and say, hey, everybody come to Everett because we're going to give you, I don't know, an extra big hug or an extra pass. But we don't, I mean, we do it now. It's informal. But I can tell you from experience, people also aren't marching into police headquarters to drop off illegal drugs. When we do get drugs dropped off, especially illegal drugs, it's dropped off by a parent or another loved one of an addict. Someone will come in and say, hey, I found this bag of cocaine. It's my son's. You know who he is. I want to get it out of the house. Turn it over. No problem. Our doors are open 24/7. We've had a drop box for drugs in our front lobby for quite a few years now. One of the first departments in the area to have one. This weekend, we participated in the DEA annual prescription drug drop-off event. It's really a day of awareness. Just so you all know, we ended up disposing of 8 boxes and roughly 229 pounds of drugs from this event Saturday, and some of it included other medications that we had previously had that needed to be dropped off. So that's a pretty good amount of prescription drugs to unload, and we've been taking that off the streets on a pretty regular basis. Our drug box at the station and the one up here, I can't speak for the one up here. I know we help empty to get rid of it. I know the one at the station does a great business.
That's incredible.
It's one of the lowest investment initiatives we've ever done. That, you know, at the end of the day, especially with the narcotic type drugs, you really can't measure the prevention that you're doing. But it's all good stuff.
Yeah, no, that's incredible. 220 plus pounds of narcotics off the streets can only be a benefit to the community as a whole. And I applaud the department for taking that initiative and getting involved in that program. Congratulations to you as the chief.
Council, keep in mind too, you know, we're not immune. When I say we the police department, we come from all different walks of life and have family members, you know, brothers, sisters, you know, parents, loved ones who have had addiction problems. So officers are sensitive to it. They try to help who they can help, not only their own families but in the public. But we found that, you know, people have to be ready to accept help and want help. Until that happens, it's very difficult.
Yeah, no, and I agree that there is many officers on our streets today that have individual loved ones that have been affected by this. I know many cases personally of individuals that have been affected in families. It touches all families across the board. But I was just wondering, I know, again, Chief Campanella has been really successful in Gloucester, and like I said, I think there's 2 or 3 other communities that have really amped up their open door policies. And Chief Campanella said that there are, in Gloucester, a lot of individuals that are sort of surrendering themselves because they're no longer a fear of prosecution. They know that they can go and get help and they're not going to be turned away. And, you know, Chief Campanella, Councilor Mangan, and myself and a couple of councilors attended a Watertown town meeting with some folks from the community, and he gave a really good presentation on how persistent they are when somebody does come into the police department and they want to surrender themselves. They you know, they continuously call and ask for a bed until they get one, and they don't just say, well, you know, today we don't have one, maybe come back tomorrow, might be able to find you one. Those are the initiatives that our police department needs to but needs to maybe do a better job at really taking the horns and running with it, because Chief Campanella said that they are having great results in Gloucester. And I know you guys are doing what you can right now, but me, you know, seeing statistics that we're number 1 in again, those are arguable statistics, but we need to do something different than what's going on today, and I'm not sure what the solution is.
Well,
and I think having conversations like this, where we're not saying it's any one person's fault, which it's not, but just how do we do it as a community, how do we do it as a group, is great, and that's why I just wanted to bring it to your attention. But thank you, Chief.
Yeah, Councilor, the issue of, you know, we don't, again, I just want to reiterate, make sure we're on the same page here. We don't arrest, it's not illegal to be a drug addict. So we're not arresting people for being drug addicts. When you say come to the station to surrender themselves, there's nothing to, you know, if, again, someone wants help, we'll try to match them up with help. But that's not a crime. It never has been a crime. We can't even, right now, in present day, I mean, the laws are finally changing, but, you know, we couldn't in the past just stop someone who looked, based on our training experience, that looked basically high, unable to take care of themselves. We couldn't legally take them off the streets. That's, you know, so there's been a change in thinking and how business is done, but I think it's extremely early to see the success of any program like that in Gloucester, because, I mean, one of the things I do know, the negatives that doesn't appeal to me is I would not want people coming from outside Everett to say, oh, this is a community you can now go to and potentially bring their problems here when there's, you know, they're from another whole community, another state. And that's what's gone on in some of these instances. So, and then what's the relapse numbers like? So if someone's going into, coming in to get help, and they go get help, how long are they clean? How long are they staying clean? And how many are relapsing? I mean, those are the things I'd like to see, because if they're relapsing on a regular basis and keep coming in, then that's not solving a problem. That's just maintaining a problem.
Sure. When I say surrendering, I don't mean surrendering themselves, but I mean coming in with whatever narcotics that they're using and saying, here's what I'm using, this is what I need to, give it up, so that they don't have it in their homes any longer. So when they do get help and get clean, that they're not going back home to the same problem that they just got out of. And that's where the chief said that's what they're handing over to the police department and saying, this is what it is, whether it's heroin or whatever the case might be. And that's what I meant, not surrendering themselves as a person, but surrendering.
The other, we don't see, the kind of drugs you're getting off an addict, slim to none. Most addicts that I know that have gone in for treatment, they're actually getting high before they walk through the door to go to a treatment facility. That's very common knowledge. We don't see people coming in to surrender. For someone who wants help, very rarely. I haven't seen it happen much. They're walking through the door wanting to surrender drugs. And then if they are surrendering drugs, it's more the opposite. We have an encounter on the street, and we find drugs on them, and they're in such a bad state that when we know they're a user and they're addicted, we're not charging them for the drugs. That hasn't been going on for a long time. Those aren't the people that are getting charged with any offense. So
I appreciate
that's
the
our
information
experience.
tonight. I know we can continue to have a discussion as your door is always
Sure.
open, and I appreciate the information tonight. Thanks, Chief.
Any other questions from the council? Ursh, on the floor. Councilman Mangan?
Thank you, Mr. Rollins. I know we had talked in the past, and they talked about funding and so forth, and have you had a chance to talk with the mayor about, permanently funding maybe a few positions, health care workers and so forth, councils and so forth, to be able to deal with, some of these different issues that you got, not only brought up tonight, but been brought up in the past? And I mean, if you formulated any opinion about, what type of funding, what would we need, and what type of personnel we would need in terms of trying to at least put a dent in this?
Sure, thank you for the question, Counselor. Firstly, we do have a grant-funded position funded through the Department of Public Health, which we're in the process of hiring for. That's a 5-year funded position that will allow us to create a new role in the health department that will focus on youth prescription drug misuse, youth being age 12 to 21, both in school and out of school. So I think that will be a huge benefit for the city. Obviously prevention's a huge piece of this. So that will add, I think, significant capacity going forward. I have had some preliminary discussions with the mayor and with Kevin O'Donnell, the chief of staff, and those discussions will continue. My sense is that either bringing on board potentially part-time recovery coaches or a clinician similar to the Arlington model, whereby they have a mental health social worker clinician based out of the police department, which that's not to say would have to have that person based out of the police department here, but somewhere, on the city staff. That person has been serving as a one-person response team in Arlington and going to follow up on overdoses. And I think, I've seen a little bit of data there. So some folks don't want to talk to her. Some folks do and take information, and some folks actually go through and get treatment. So I think that model is promising, and we'll continue to talk about that.
All right, would there be a possibility that the person that does that in Arlington, you believe at some point that person would be able to come in front of us and would be willing to speak in front of us about, testifying in terms of, what their role is exactly and how he or she believes they're making a difference and so forth in the city and the town of Arlington, whatever?
Sure. I know the town manager in Arlington, and I'm sure he'd be supportive of allowing her to come. It would certainly be up to the Arlington police chief, who I think supervises her, but.
Right, and certainly if we were to have something like that here, whether it's in conjunction with the police department or, at City Hall, whatever, like I said, that's a matter between the chief and the mayor to discuss that, what do they think the person could best be utilized, but certainly, and then the lady in Arlington, she's full-time,
She is full-time. They are in a very unique situation in that she works full-time for the town, but she's funded through a nonprofit. So that's sort of a unique, innovative partnership they have, but she functions as a full-time municipal employee.
Okay. All right, thank you very much.
Thank you.
Any other questions? I have a few from the chair, and I also have to speak on number 1 as well. There's a couple of others here. According, well, to notes that I've seen before, coming out of our hospital here, it says you died today, and then they release them, and then it says seek help. That's what they're doing with these people that overdosed and resuscitated, and then a full resuscitation, meaning they had to basically code them and then Narcan them. Then they come back, and then they send them home with a note like that. I don't think that's probably the way to go. I think we probably need to, and this is a statement, we probably need to actually send them somewhere where they can seek help. That might be a better way to go about things. In order to actually get the manager here from another city, all we have to do, Councilman Mangan, all we have to do is just invite them, and then they'll come. And then I know that because there's gonna be a few more coming in anyway. So, there's a couple of programs that we're gonna be also doing, program people from different cities that I already contacted through Everett Overcoming Addiction. They should be showing up here too to give us some different type of programs and different styles of programs other than the police doing it. They're doing it in different cities and towns now, so we may have to, research that and then get them done here. We need to start getting some programs going. Chief, let me see. How many, just a rough figure, how many overdose calls are you getting or responding to per month?
Well, I hate to give a rough figure, a lot.
Just give me a rough figure. You know what, I sort of got some figures from the hospitals already. I had one of the
We have the
chief.
data, I don't know if, I mean, it doesn't change much, it's steady, I'll tell you that much, it's steady per month.
Is it a lot?
It's
We'll
a,
just-
oh yeah, it's steady, it's a lot.
Okay, so it's a good number, because the numbers that I was getting out of the hospital was something in the area of like, they're doing 1 to 3 to 4 resuscitations a day. And it's coming in from different.
Keep in mind, yeah, it's coming from numerous
It's coming in
cities.
from like
Yeah, yeah.
Chelsea, it's coming in
Yep.
from Somerville, it's
Yep.
coming from East Boston, Revere, all that stuff. But I wanted to know specifically our figures, because they mentioned we're #1 in the whole state and all this stuff, and I don't know if I really believe it now, because I think they're taking the data from all the surrounding areas as well. So,
Well.
but I'd like to
It's a matter of
actually.
What the data, which data you're looking at, and, is it based on a per thousand population? There's some reports out there, it's per 1,000 population, depending on what your city census is, and is that accurate what you're getting for a population?
Yeah, I mean, we're looking, it's hard to believe we're better, we're #1, other than like, the Worcesters, the Leominsters, the Fitchburgs, the Bostons, the big cities that are around us per population. It's kind of hard to,
The big cities have way more overdoses in general and overdose deaths. But
this is per popular?
Per 1,000, yeah,
Okay.
we're not #1 in that category.
All right.
By far, having the most
Yeah,
in
I
the
was gonna
state now.
say, yeah.
It's per 1,000 population, but our census, I always say, is always low, on the lower end.
Okay.
Anyways,
So but we have a number of people that are overdosing that we're responding to.
absolutely.
Okay.
Yeah, I mean,
And
it's dozens plus a month.
All right, is there any way we can get the numbers monthly from you? Just a report?
Sure. Oh,
Okay.
yeah. Yeah,
If we can get, I'd like to see if we can get a written report. Reason being is, then we can send it out to the rest of our colleagues on the council, so they understand what we're trying to do here. And then when we were asking for money in the budget for the nurses program, we can actually get it and have some backing behind it.
Sure.
Thank you. This is to the health director. Now, you're going to obviously be putting this into the budget, correct, for the Narcan?
Yes, I believe it will be put in our budget for the health department to have the Narcan. We have Narcan presently, but it just expired. So there is a new program that was advertised today, in fact, that they want to give nationwide to every high school, supposedly Narcan.
Is that a
but
grant?
But, of
See,
course, they
Mrs.
don't tell you
Rollins
how
saying
to
yes.
do it, and who's gonna get it first, and you'll be on a waiting list, because there was one time before that they would give Narcan to all schools. You didn't get it. You had to apply, and, it was gone before you know it.
Okay.
So we are looking into that.
So because I know that the fire department and the police department currently have it on their vehicles right now.
Yes,
correct?
they do.
Okay.
Mhm.
And how many are out there on, Chief, you might know this number, how many are out there in the cruisers now? Are there two, like, nasals? You guys carry the nasal?
I think, yeah, they're in a bag. I don't know, I'm not sure what the exact numbers are in them, but it goes out in each, there's
Because
certain
sometimes you have to hit these people two times
Yeah.
to get them around, you know what I mean?
Yep.
So we may
But there's
want
a
to
number
look at
of
that.
kits that go out in each bag that get spread out into a number of cruises.
So we have them,
Yep.
we're all set. You know how much about that cost on that?
Offhand, I don't.
Is there any way-
I mean, it's the same ballpark. I mean,
Same
you're
as
talking the
that?
cost of the
On the
Narcan itself?
Yeah.
Yeah,
Was
the
that
bo-
with a grant, or was that?
Yeah, this has all been grant funded so far.
Okay.
Correct.
All right. Are you going to be asking for an item in the
I
budget as
think
well?
there's I think we have more coming in? Yeah.
Through the grant? Okay. Thank you.
Yep.
Let me see here. What, Kathleen Rollins, what date is the school date going to be? And if you can just explain a little bit about that.
Sure. So the school department has blocked off some time the morning of Monday, May 16th, to allow our working group to bring in some speakers to talk to the seniors about the effects of addiction and substance misuse. This date was targeted because it's a week before prom.
Sure.
Senior prom is that Friday. So we're currently in the process of working with the school department to ensure that the speakers that we present are folks who have spoken to other students in other school districts before and have a message that is consistent with what school guidance department and health department are also teaching the students to try and reinforce the message.
So it'd be sort of a collaboration between the two groups?
Yes.
Okay. And then, have you reached out to those people?
We are reaching out to folks. We're in the process of trying to figure out who the right mix is. We want to make sure that everyone who speaks, again, has spoken to students before and not just adults, and has a track record of having spoken in other high schools. So
I know
it's-
some names that have been submitted, they've actually spoken to crowds of people. So, they may be very well, we just need to take a look at them, is that what it is?
Yeah,
Okay.
the school department wants final approval on
Sure.
who's going before the students.
Understandable.
Right.
All right, so that's May 16th, and that'll be going on just that day, or is it gonna be a week-long event, or?
So it's, apparently there's some scheduling complications around finals and MCAS and a few other things, so they thought that Monday was the best day, but then for the younger grades, we have into June to try and get some
Sure.
more speakers in front of them.
Now, the Monday, will that be an all-day event,
No, it's the morning.
just the morning?
Yeah.
Okay. All right, and the grant, I don't know if I should ask you or the nursing director, health director, when is that going to start? When is that person gonna be hired? Today, tomorrow?
Hopefully soon. We've conducted the first round of interviews, so it's just a matter of going through the process and getting.
Do we have a candidate anywhere in sight, or?
We have a preliminary candidate,
Preliminary,
yes.
yeah.
Okay. And roundabout figure, when should that be starting? Because there's
Soon as we
been,
get
there's
it.
been a lot of talk about this, and we want to actually get it up and running now.
Oh,
So,
absolutely. I'd say
Yeah.
weeks, matter
Yeah.
of weeks.
Couple weeks?
Hmm.
Okay. And,
Counselor, I could give you a little bit more information if you like on the overdose. I was able to bring up
Sure.
a report. So year-to-date, this was the end of March, we had 34 overdoses this year.
34
34 compared to 33 same time last year.
and 33, okay, so we're up one right now?
Correct.
Okay.
It's on the same pace, yeah, same clip.
Still, I mean, that's a lot, I would think, you know what I mean?
Yeah, it's in
For
about-
for a 3-mile community, it's kind of a lot, I would think. But, I mean,
Well, one of the problems around here, I mean, between Everett and surrounding cities, these are some of the most densely populated, they're the most densely
Oh,
populated in the
absolutely.
state.
Yeah.
I mean, there are a lot of people in and around, connected to us, traveling through here, so, it's, you know, there's more people.
Now, when you say that, that's an actual overdose, chief? Someone that they're coming in, they're saying, what they're responding is a non-breathing overdose, or is it just overdose? Or how is it coming in through you?
Well-
Because medically, what they're not reporting is the unresponsive, non-breathing, unresponsive. Then they come up with a different title, like, you know, they say it was a heart attack or, you know, a
Yeah,
lung
we're not
disease or
break-
something to that.
So we're trying to make sure that, so let's say we get to a unresponsive male, we've told, you know, we're trying to get our officers to give the proper feedback so we can code these as
Sure.
overdoses. So if it goes out as a unresponsive like male, and, you know, it might get coded as a medical aid.
Yeah.
They get on scene and they recognize it's an overdose, we're trying to make sure that
Do they code it? They
that
code it
code
back?
gets attached so we can keep track. That's the whole idea of
Sure.
doing this. And some come in many come in as overdoses.
Is
Probably-
that, I
probably
mean,
majority of them.
is it tough right now for them to code it that way, or is it?
Well, it's just it's a matter of how it comes in, who's calling it in, who's this coming in by?
Yeah,
Is
yeah.
it a family member, is it a friend, is it a bystander, is it someone walking by and find someone on a bench? I mean, it depends on how they're reporting it.
Sure, sure.
And so, it might get reported as something else. Most cases, it's a minimum, it's reported as a medical aid. And then we're trying to make sure that we, you know, train the officers repeatedly, trying to hammer into them that, hey, you know, make sure if it turns out to be an overdose, that it gets added. Now, once it's coded like that, we don't always have the results. They go in an ambulance and go on their way. We don't always have the results of what transpired with them. Sometimes when we get to the scene, they might already be passed away.
Yeah.
And it's too late. Those ones we know, some we don't know the results are.
Now, does, the follow-up question to that is, does an officer actually go to the hospital with them?
Not all the time, no.
Okay.
No.
Because you're not gonna have the manpower to do that, I don't
No.
think. All right. Chief, another question for you would be have you heard about this now? It's Xanax Ventolin. It's a pill form. There was 9 deaths in one night in a place down in Florida, and it's working its way up the coast, supposedly here. It was just, they started talking about it on different network programmings and stuff like
Sure.
that. So,
Xanax is widely abused, I know that.
oh, yeah.
I mean,
And now it's a pill form, but it's mixed with fentanyl.
Sure.
And what it's doing is they take, you know, whatever amount, and then they're dying.
Well,
There was
that's what
9 deaths in
The
Florida.
mix of anything with fentanyl is what's killing most people right now.
Fentanyl and heroin.
Yeah.
You know, are you seeing a lot of that? When you test for it, can you test for fentanyl or no?
There's testing out there. It's not always done, it's not done by us. It
would
goes
be
to
a
the
lab? Yeah.
Yeah, when we get like the results back, and we're usually getting results from cases that we're doing. So if we seize narcotics that are going forward in a criminal case, we'll get the lab results in with the, you know, the drugs for a trial, and it'll tell you what's in there. But that's what they're finding. There's a lot of fentanyl mixed in with heroin and other drugs.
Now, is there any higher sentencing if they're actually caught with the mixture of heroin and fentanyl?
No, I think they're
Should
they're
be.
trying to make something separate for fentanyl right now.
Yeah.
But normally, well, here's the part of the problem is like, so, say, you know, a block of, I use my phone, there's a block of heroin in packaging comes in, and what they're finding in some cases is down this end of the package,
Mhm.
this part's all fentanyl. So when that's getting, and then the rest is heroin, when that package gets opened up and diced up to go put into smaller packages, some of that end, pure fentanyl, is going into packages,
Yeah.
not mixed. And so some people are getting those, and then you're getting those batches of overdose deaths.
Yeah.
That's what they're seeing, you know, and that's just, you know, someone did a poor job of mixing, but this stuff is extremely dangerous. Extremely dangerous stuff.
I agree, it's killing people. Now, do you know of any lawmakers that are actually participating or looking into making a stiffer penalty or a criminal offense on it?
Well, the penalties are pretty stiff. I mean, if you're trafficking in heroin, or distributing heroin, both at the federal and state level, the penalties are stiff.
What are they now?
There's no sympathy for.
Anybody with weight?
For people, yeah, it goes by, usually by weight, and depending if you're a repeat offender.
Sure.
But no, that's serious, it's taken serious, that's why people are not, this whole thing comes up about, turning in drugs, as was brought up, a guy that shows up to drop off, 20 grams of heroin, that's not a drug addict.
No.
That's someone.
That's someone you're putting in cuffs.
Exactly. And there's been some concern from the law enforcement end on, you have to be careful when you want to start changing laws like that, because, someone's driving by a nearby Everett PD and all of a sudden sees himself being tailed by somebody. Hey, let me pull over to the PD here and go in and drop off because I want to turn my stuff in.
Sure.
But we don't see addicts walking around with that kind of weight.
Yeah, I mean, the ones with the weight, they're going away for a time anyway.
There's usually, again, those are the people that are poisoning people on our streets. I don't think there's a lot of sympathy. Again, we don't control what happens at the justice system.
Sure.
We only present the cases. A DA prosecutes them, and what happens, happens.
Yeah. Now, this right here, I wanted to mention it just as a awareness type thing, that these type of pills are out there
Sure.
now. And that we should know about them if they actually do make it to our streets. So
Yeah.
if we start seeing people ending up dying in the streets by taking Xanax, you know why. You know what I
The
mean?
education piece is important, and awareness, sure.
Absolutely. Councilman DePiero, you had something? Okay.
Thank you, Mr. Chairman. Ms. Rollins, I know the city has received some different grants for Narcan and the council position we talked about. Are there any other grants that we have received or are currently seeking in the near future?
The other grants that we have received in part are sort of cluster grants, which means that the grant is awarded to several municipalities within the region, and the Department of Public Health sort of makes up the regions as they go along, so it's a different region for each grant. But we receive something called SAPC, which deals with mostly drugs. We're part of something called MOPSI, which I believe is more alcohol. We do receive all of the state Department of Public Health funding for substances that we are eligible for. The only other grant funding opportunity that I know of is a federal opportunity that would require a match, and I believe the application process would be time intensive, so it might be something we could start planning for now if we think we're gonna have the resources to match it and figure out which community partners to get to the table, because it's a big picture, everyone needs to be involved type of grant. Other than that, there really isn't much out there. There is something that would ostensibly fund Narcan for the high school. That's through the Clinton Global Health Foundation. And I believe what they did was sort of go to the state's Department of Elementary and Secondary Education and put them in charge of distribution. So, that's something we can look into with the school department just to make sure that they're in touch with the right person at DESE who can connect them with that opportunity. But that, at the present time, that's all that is out there.
Okay, thank you. And before I yield the floor for any more questions, I just wanted to thank all of you once again for appearing. I know it may seem tedious. A lot of you guys have been here several times, but your input is essential because we have many residents and community groups that offer ideas. We see ideas, whether it be through social media, news stations, and so on, and your input is essential. And I want to stress that this relationship is a revolving door as well. If there's any way we can be helpful through appropriation of more funds, through anything that you may seem fit, please let us know as well.
Thank you.
Thank you.
Any other questions? I just have maybe one or two. Actually, to all the department heads, if you're looking for funding, this is the time to do it. So, and if you're gonna fund a project like this is probably the time to get it done. So, this would probably be, and I echo the sentiments of all my colleagues here, this, put in for it, and we'll have to see if we can get it through. We're gonna be shepherding it through. So, the information that I'm requesting is going to help us get this through. So, any information that we have is key to us. So that's why we keep coming back and rehashing different things. But if you're up here, it's for a reason, because we're trying to stop something that's gone completely out of control. I thank you all for coming. I think, I need to ask this, Chief, with the medical marijuana, synthetic medical marijuana, can we do anything that would be within a school zone or a school system or anything around the school?
Medical marijuana?
No, synthetic marijuana.
Synthetic marijuana?
Yeah.
Um,
Because, like, there is some schools that touch stores that are actually selling it now.
That's something that we'd have to research.
Okay.
Research that.
So maybe if we could maybe get that back, what's the time frame that you need? And then maybe we can give that.
When do you meet again?
We meet monthly right
Oh,
now,
we should-
so.
we should have some feedback for you by then.
Counsel, are you referring to the Department of Public Health has not finished the guidelines and is in the process of sending out guidelines to local health departments? And some cities and towns have already put moratoriums on where exactly that's what you're looking at.
So maybe we could just put a moratorium on it now?
It
And
would
then-
have to go through, it would be something that would go through your Board of Health, and it would go in relation to tobacco control. Our board is brand new, we just got 2 new members, and they are meeting in May for a public hearing for something, but tobacco control in regards to e-cigarettes and single cigar selling, and the tobacco age, as you very well know, is probably gonna go over 21. That's
Sure.
gonna be a statewide thing. So that's something that they will also look into, and I will bring to them, and anything on that, I'll send you the information.
That's what we need, because we could put a moratorium in on it if we chose to, as legislators here. So we just need the information and backup from you.
If
That's what
something,
we
I
need.
just want to reiterate, so if something's not designated as an illegal drug,
Mhm.
there's nothing you can do.
Okay, so is it designated or not, Chief?
It depends on, there's so many different
There's variables.
items out there, that's what's hard to say. I mean, unless, like, for example, if marijuana is a Class D drug, unless it's tested as such, and first of all, marijuana is decriminalized anyways,
Yeah,
so we can't,
well, we put a little bit of a price tag on it, but that's about it.
Yeah, but
Yeah.
it's non-criminal for possession purposes. But synthetic so it wouldn't make it wouldn't make a difference. There's not much we could do about it. I mean, the only thing we can do under the ordinance that we have in the books, we're trying to control the public use of marijuana. We, kind of like with drinking alcohol. We don't want people
Like a
drinking
6250 charge?
alcohol in the streets. Well, I don't think I don't know if it's the same as that anymore.
You know what I mean?
Yep. But there's a whole bunch of different brand names of synthetic.
So would you be
drugs
able to,
out
I mean,
there.
would you be able to research? I don't want to
We
bog
could
you down with that.
Research, but if it's not illegal, like, I can't see marijuana, Class D marijuana as it is no longer illegal.
Sure.
It's non-criminal.
Is there
So
any
I-
way we could, maybe I should try to spin it a different way here. Is there any way that we could do something within the school zone to actually get it out of the school zone? As we
Just
did
for
with,
that, in terms of the medical marijuana stores, I think that's what you're more or less looking for.
Not just so much that, but the synthetic marijuana and
What you
tobacco
can do
products.
is-
School zones are shrunk up
Shrunk,
now, too.
yeah.
They've changed the laws. They're no longer 1,000 feet. And the schools have to be open. It's a smaller distance. It's like 100 feet now. It's
Well,
it's a lot tougher, but they're not, the laws were never real tough on marijuana to begin with.
no.
And I'm not sure really what you're asking, where you want to go. So whether it's regular marijuana, synthetic marijuana, there's not going to be a lot of teeth in the law. I mean, my biggest concern from a public safety standpoint is public use of it. I mean, we know people are going to use it. It's public use. We don't want them using it in parks,
Sure.
playgrounds, and other public schools.
Are you seeing that now? Is there a lot of it going on?
Well,
a lot of active?
the smell of marijuana is, especially in the warm weather, when windows start opening up and cars, more people are out, the odor's out there. It isn't, I don't want to say the streets aren't being overwhelmed
Yeah.
with it. Some people use discretion, smart about it, and some aren't. I mean, the ones that aren't are the ones that we want to have conversations with and
Sure.
address.
If they're openly blatant about it. and
Correct.
They're sitting
Yeah.
in a park full of children,
Yep.
yeah, that's a problem, I would think.
Yeah.
All right, so can we get some information back on that?
I'll try to
And then-
do some homework and see what
Yeah, I mean,
what's out there.
we'll put something together. I'll refer it to you, and then we'll reintroduce it
Yep.
probably at some point here. And we may even send this up to the legislation, I think. Can we do that? We could send this up to the legislators up at the State House and see what they come up with as well. So in the intimate period of time, we could probably meet in the middle somewhere on something, a good piece anyway. And maybe it will come out of Everett, you know what I mean, as a good light. So are we done? I want to thank you all for appearing tonight. And if you could have all the information back to us with the designated times, that would be great. And then we can go from there. Thank you for all appearing. Excuse the customary thanks. Thank you.
Thank you.
We have 4 pieces that we have to designate where they're going to go, so. Thank you for appearing. On item number 1, should I hold that over? Or just send it and then with a response from them in a month? Chief and Health Department. Okay, on item number 1, I'm going to hold this over, waiting for the response from the chief and the Health Department. All those in favor? All those opposed? You have done so. Councilman DePiero on number 2.
I think we had a pretty good discussion about this tonight, and I'm comfortable with favorable action
Sure.
on this piece.
Favorable action on item number 2. All those in favor? Where do you want it to go? To the school committee and as well as the grant writer and health department?
Yes.
Okay. This should go to the health department, the school committee, and also the grant writer, Kathleen Rollins. And what, with a report back in a month or a favorable action on it?
Report back.
Report back in a month. All those in favor? All those opposed? The ayes have it. Item number 3, Councilman DePiero.
Item number 3, I believe we should grant further time on, as we're going to get some more information.
Yeah, and we should probably ask for a fire team to come up,
Mhm.
or someone from
Get
the
their
union,
input.
someone from the chief.
Second.
To invite the fire chief and the union up for discussion on this piece and grant further time. All those in favor?
Aye.
All those opposed? You have done so. Number 4, Councilman DePiero.
On item number 4, can we refer this to our chief of police and our state senator and state representative for further research,
And the health department.
and the health department as well?
Second.
We'd like to refer this out to State Representative DiDomenico and State Senator DiDomenico, and he's probably watching. So correct me if I'm wrong. State Senator DiDomenico and Representative Joseph McGonigal's office will reply back within a month, and also to the police department and health department with a reply back within a month, and invite them back to discuss it. All those in favor?
Aye.
All those opposed? The ayes have it. Motion to adjourn.
Second?
All those in favor, all those opposed? You have done so. Thank you.